Om Shanti Captain. How are you, dear?
Shanti. I'm good, thank you. Yourself?
Very well. And let's start the session. Come into the sitting position. Keep your back, neck straight, aligned, and relax. Gently close your eyes. Of your alignment. Your back, your neck. Now, take a deep, prolonged, slow inhalation. Deep, prolonged, slow exhalation. Inhale and exhale. Now, inhale for the 3 times Om, along with Shanti. Take a deep breath. Om. 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 Shanti. 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 Feel the vibration and sensation. Join your both palms. Rub your palms. Place on your eyes. Very slowly, while blinking, looking at your palm. Gently open up your eyes with a great smile. Om Shanti. So, I wasn't well. That's why therapy class and meditation class are postponed. So today, in previous session, we discussed about the gastrointestinal problem, the problems which relate to your stomach, small intestine, large intestine. So we discussed about the IBS, irritable bowel syndrome, and constipation, indigestion. So how we can help, through the treatment of how the yoga therapy gonna helping you. Then. So discuss about the diet, right? What kind of food they can take it. I talked about that in constipation. Plenty of water should be given, and raw vegetables, raw, fruits should be given to them with the fiber, like with the skin. But if you have indigestion and diarrhea symptoms, then you have to change the diet. You have to take the easy digestible, food, and raw and sprouts completely, cutting it, but steamed sprouts, steamed salad, or even juices, fruit juices could be given to them. I mean, this basically avoiding the fiber, high fiber diet. When you get then you have to change slightly. So cooked one should be given to the in indigestion and loose motion and diarrhea symptoms. Constipation, high fiber should be given to them. But both, no matter what kind of, all the foods which are stored into the fridge and fragmented foods and processed food, packet food, and non-veg, all the kind of non-veg should be completely, avoiding for them. Even egg also. Um, Milk can be taken by in the constipation, but in digestion, completely avoid the milk. So these simple things we discuss in already in detail. Now today we're gonna discuss about how the asan, pranayam, and meditation gonna help them to cure even the colitis, bleeding, ulcers and other things, and a little bit which work as a medicine. So in asan, basically understand the asan which is related to your abdominal region, right? That's very helping. So asan which including your engaging your core muscles, upper abdominal part and lower abdominal part, where it's working. So backward and forward, all the backward and forward engaging your core, and then supine posture, prone posture, engaging your core, even balancing posture also somehow. Arm balancing posture require the engagement of the core. Even inversion is semi-inversion posture are good for the improving the digestive system. So these are things. So like few names I'm giving to you. You can basically the category is like balancing, which including the arm balancing. You require the core muscles, engagement of the core muscles. Then forward and backward bending, especially the backward bending, you require the core muscles strength also. You're working on the core muscles. So even prone postures, all the prone postures, it's giving a little bit massage to your abdominal level, lower and upper. Then so it would be Ustrasana, camel pose, then Bhujanga, cobra pose, all the variation of the cobra, locust posture, Salabhasan, which we call in Sanskrit, these posture, all the variation of the locust, or in Sanskrit we call it Salabhasan, is very good. And Chakrasan, again variation of the Chakrasan, all the twisting posture, uh, is good where you are twisting even slightly. If you can twist like one side to the another side, it gives the movement to your lower abdominal part cavity. It's improving the flexibility and improving the blood circulation of that those uh, mm, area where organs are located. Then backward bending, mostly which you do, the Hastuttanasana. This is really good for your chest also, your abdominal part also. Okay, so these are a few, but there's many more asanas. That's why giving you the classification of the asanas to choose accordingly. Uh, So backward bending, arms balancing posture, then prone posture. Through that, many asanas come into that category. You can just practice those things and you make the sequence accordingly. Along with that, you can include the feeding and giving them hold. Like if they're doing the bow posture, bow asana, like which we call dhanurasana. So dhanurasana, there is a variation of dhanurasana. Again, you have to modify according to the person, limitation and the capability. So easy bow pose or the advanced bow pose, it's totally up to the that person how flexible his body and her body. But start from the easy version always. So make them hold that posture at least 5 seconds to the 10 seconds and give them abdominal breathing when they are holding it. It's work as a wonder when they do the abdominal breathing and remaining in the posture. Then Pavan Muktasana is also good for improving the digestion. Then Mandukasana. So these two posture is very good for the even the diabetic, improving pancreatic system. Uh, Pavan Muktasana and the Mandukasana is very good for the diabetic patient also. So basically, all the organs are located in your abdominal cavity. It's improving their function. Okay, so no matter you have diabetic because of system is not or other things, these asanas gonna work for you. So even along with the digestive problems, you are curing the many other problems as well. Okay, so oxygen when blood circulation improves to circulating properly, then version or inversion, ardha halasana or halasan, plow posture, which we call in English, that is also or sarvangasana. But make sure if you're giving the sarvangasana, the pressure should not be on the neck. So uh, make sure whatever asana you are giving to your students, they should be comfortably doing it. So start with the easy posture. So semi inversion to the you can increase like just raising your feet on the 90 angle, then taking into from ardhalasana to the halasana, but it should be slowly and gradually done. Okay, then uh, so these asanas are very helpful for treatment of basically improving the blood circulation towards your lung. Good for asthma also. I talked about when somebody having bronchitis, asthma, upper and lower respiratory system problems. It's also good in for them because it's improving the blood circulation towards your heart, towards your lung also, and towards your head. So these asanas, my voice.
Oh, it's still bad, very bad.
My voice is cracking.
Not
Not clear.
not really. There are many breaks, all the time breaks. It's not understandable what you are telling, sorry. It's very bad.
Guys, can you hear me?
Now, yes. Can you hear me? Can you hear me? Can you hear me? Can you hear me?
Guys, now my voice is clear. Can you hear me?
Yes, now I hear you.
Yes, I can hear you now.
Okay.
Yes, I can hear now. Thank you.
Okay. How much you heard about it?
Nothing.
Nothing.
Yeah.
Oh, Katrina, how much you heard about it?
I got down to the Savasan for breathe. Is that for breathing?
Yes, that's okay for me. It's okay.
What we discussed, Katrina? I couldn't get you.
So we were talking about improving blood circulation to the heart.
Okay. So we discussed about that asana, right? Asana. Okay.
Yeah, that's okay
Dear,
for
I
me.
couldn't.
Okay. Okay.
Again, no, it's okay. I'm explaining about the indigestive disorder.
Okay.
Gastrointestinal digestive disorder. We are discussing about the treatment for them. So, have you attended the previous session, dear?
Yes.
Mm,
Yes.
okay, okay, you have attended. So,
Yes.
so in previous session we discussed about the constipation, right? And IBS, irritable bowel syndrome, and indigestion, diarrhea, colitis. These are the digestive disorder problems, right?
Okay.
So we were discussing about the treatment. So diet I have given already in the previous session. Now we are talking about the asana. So asanas basically all the prone posture, backward bending, uh, arm balancing posture where you require engaging your core muscles, and going forward bending that is also good for your stomach. Then mandukasana is good, and I've given you the example like bow posture, all the variation of bow posture, then cobra posture, then camel posture, camel asana, then these are the few names, and supine, prone posture. These are the classification of the asana. So, and even the semi-inversion to the advanced inversion is good for stimulating your digestive system and improving the function of all the organs which located like liver, kidney, bladder, pancreas, your bile, your stomach, your small intestine, large intestine. So any problem related to these areas would be, you are helping them. Okay, these we are discussed. Clear there?
Okay.
So asanas are you can make the sequence accordingly. You can make the prone posture, supine posture, then standing balancing posture, or arm balancing posture. You can include like sun salutation is very good for improving, working on all the muscles of your body, and that's also improving your digestive system also. That's also introduced. Then, uh, and then halasin we talked about. Halasin, ardhalasin, these are the names. So it's basically the semi-inversion to the advanced inversion. Food halasin and ardhalasin should be given to them. So these name, if you don't remember, that's okay. You can just know that inversion posture is good for the stimulation of the digestive system. Okay. Then coming to the next, what kind of pranayam should be given to them? So breathing practice. So especially in pranayam, I keep talking about it that pranayam should not be practiced by all the people. There is a major precaution one has to go through it, and you should know the medical history of those, patients. Especially if you're introducing like, for example, you cannot introduce the um, bhastrika to the hypertension patient, right? Or bhastrika pranayam to the person who is having cardiovascular related problems. So you have to go through the medical history that they should be, at least they are not having the major issues. So with the pranayam, there is a major precaution one has to go through. Understood? This much you understood? In pranayam, you cannot introduce any pranayam like that. You have to understand the medical history. Clear this much?
Yes.
Okay. So how we can help them? So what you can do about it? You can do one thing, introducing basically the breathing practice. So abdominal breathing, I'll just so what kind of practice you can give it to them? So abdominal breathing, then chest breathing, which we call thoracic. Number two, chest breathing. Okay. So 15 minutes abdominal breathing, 15 minutes. Chest breathing again 15 minutes. Okay. Second. Then third would be yogic breathing. You learn from the pranayam class. So okay, yogic breathing. Then nadi shodh. Nadi shodh. धन ठीक है नाड़ी शोधन pranayam. These are the safe breathing practice. Okay, you can introduce to anyone. So these breathing you can write it down. It should be given to them 15 minutes. Understand the problems which I am talking about. It's could not be treatable through the allopathic medicine. Allopathic bring the temporary relief, but it could not cure from the root. Okay, and I keep talking about these problems are very common. Most of the people are suffering from these normal problems, right? I think out of five, every two persons are having these problems. So breathing is very much important. So these four types of breathing should be introduced, and more should be practiced by the person who is having any problem related to digestive disorder. Okay. So digestive disorder or the disease disorder is like which is becoming the psychosomatic, or the disease is like because of something happening environment or because of food or something like so it would be the disease, bacteria infection or something. But disorder, if it's disorder, it means it's psychosomatic. It's related to your psychological aspect. Okay. So these breathing, along with one thing they have to go for it. One thing they have to understand. I'm gonna rub. So one breathing that called right nostril breathing. Right nostril breathing. Okay. Now, right nostril breathing means you have to inhale through the right and exhale through the left. So this breathing should be practiced even anti-stomach morning time also, but before the meal, before meal, any meal. So if you're taking the meals like you're going for breakfast, lunch, or having the light dinner also, even that time you have to do the breathing. This breathing plays very important role. It's improve your digestive fire, 𝐸𝐴𝐺, which help you to assimilate and break the food easily and digest the food easily. So before the meal, 15 minutes you require to practice. Whenever you have the solid in your diet, like you are having the proper or dairy products you're gonna have, right nostril breathing you require to practice. No matter what you're gonna eat, fruits, vegetables, chapati, rice, porridge, nothing important. Before eating anything, right nostril breathing 15 minutes one should practice. And it should be done with lots of consciousness awareness and very slowly should be practiced like deep inhalation through the right, again exhale through the left, again inhale through the right, again exhale through the left, again inhale through the right, exhale through the left. Keep inhaling through the right and exhaling through the left. This breathing should be done. Okay. So understood this one? This breathing is play very important role any disorder of the digestive related problems. आँख बंद करके just close your eyes and tell them practice this thing. Before eating, do this practice. This much you understood?
Yeah.
Right?
Yeah, I got it.
Okay. So now, um, and yes, I talked about no ice beverages, nothing, don't go for the fast food or outside food. Cold things should not be given when you have digestive disorder. It means you have to take the warm things, lukewarm or warm things, and fresh. Everything should be fresh, should be given to them. Then come to the meditation, breathing part is done. What kind of meditation we can introduce to them? So they can. I taught the anapan also. Anapan is good for them, but also they can go for the Brahmri pranayam, Brahmri practice, or the pranav meditation, all the form. So they can go for the in pranav makar chanting. So makar chanting, I taught you in the meditation class. So makar chanting is ideal one. Though they can practice other like anapan also. Okay, anapan meditation or the makar chanting, but it's totally your choice. But makar chanting works wonderful on them, or pranav like chanting. We did in the pranav chanting, chanting also they can practice. Okay, so and Brahmri pranayam also they can practice. Brahmri pranayam would be also given to them. Uh, so But one practice should be for longer period of time. And if they're practicing makar, so they have to go for the makar chanting for longer period of time. Okay. Anapani, if they are practicing through anapani. So one practice they have to choose and make, just see them which meditation they are connected, and then they are keep doing that practice for longer period of time. So they control their digestive disorder by doing the meditation. Meditation plays very important role, especially for psychosomatic problems. Okay, so these are the options for the meditation. Then Shat Karma, what kind of Shat Karma we can practice? Shat Karma, the cleansing practice. Shat Karma. Okay. Shat Karma cleansing practice, six cleansing practice. So in Shat Karma, Neti Kriya, but again you have to learn under the guidance of the teacher, yoga teacher. Neti Kriya, cleaning of your nostril. Then good, because it's work on the mental level also, Niti Kriya. Then Kunjal Vaman Kriya, which we call Vaman Kriya. But again, with lots of precaution, okay, you require the teacher under the guidance of the teacher. Even you cannot teach until unless you haven't practiced for longer period of time. Vaman Kriya, Kunjal Kriya, again, lots of precaution one has to see, but it improve your fire. It give you, when you lose your appetite, it increase your appetite by practicing the Vaman Kriya. So Kunjal Vaman Kriya is like puking. You do puking or vomiting. So plenty of water given, saline water is given to the person, and then they puke later on. But this practice should be other again. So other things is also required. But I'm just explaining what is this kriya. This practice is going to help them to come out from their psychosomatic problems, any mental, if mind is disturbing their body, their digestion, it would be helping them to come out from that. Okay, so Shat Karma, then meditation, asana, then breathing practice. These are the breathing practice. So once they get the problem, so they can divide like 1:30 morning time, 1.5 hour in the evening time. So 3 hours they have to give their life. Like you have 24 hours. So 3 hours you should give into yourself for this treatment, and then you're gonna see the results very quickly. So the treatment, how long this treatment would be going on? The treatment is not. It's like the effect you can see within the 1 month, but I think within a 4 or 5 months you will be recovered, and for never get that situation back, you have to continue for forever these treatment, and it's even bringing the health to you. It's bringing you, you feel more connected towards your body, and then by practicing daily, you are working on yourself. You are improving day by day. So it's not like one day you practice or 1 year you practice and then you can stop. Like you never stop eating right, you never stop drinking the water. So I don't know why people think that once they recovered fully, they have to stop practicing the the yoga therapy treatment. But it's forever you have to. It's like food for your body. It's food for your mind. Even prevention you require. It's outside there's other problems are going on. So you have to be just on that track forever to maintain your health. Once you get the health, you have to maintain it, right? So you have to practice daily. But people are misunderstood and they think, okay, it's like a pill. When I'll be recovered, I stop taking it. But that's not the way the treatment, work. Then later on, it's become your lifestyle. And lifestyle, it's become your part of your life. And then you it's you. It's day by day you are developing yourself. You're not struggling with the routine of the treatment then. And then you come out from the root problems. So this is the all about digestive disorder. In tomorrow's session, we're gonna talk about the mental disorder and talked about dementia and other things. So any doubts you have? Any question?
No, that was good, thank you.
Okay. So everything is clear?
Yes, thanks.
Okay, lovely. So tomorrow we'll finish the therapy session. So and day after tomorrow I'll give you one class session for the question answer session. Any question answer session, any questions you are having related to till now, whatever topic we covered, you can ask me, okay, in that time. And students are not coming in the class, so I don't know what happened, but that's okay. So so we're gonna end the session with the chanting one time Om and Shanti Shanti, and tomorrow we're gonna meet, okay. In meditation class, if you have question, because we covered all the topic of the meditation, if you have any doubts, you can come to the meditation class.
Okay, thank you.
Okay. So we're gonna come to the sitting posture, keeping our back neck straight. Take the deep, prolonged inhalation. Exhale. Inhale for the Om, one time Om and Shanti. Shanti, Shanti, Shanti. Join the both hands. Now deep hands. Place on eyes. Very slowly while thinking, looking at your palm. Gently open up your eyes with a big smile. And saying Om Shanti, the best teacher, bless you.
Om Shanti, thank you. Night.